This video will explain the use of diary cards in dialectical behavior therapy. DBT is a form of cognitive behavioral therapy that is effective for addressing the needs of clients with severe and complex emotion struggles, including those struggles related to self-injury and borderline personality disorder. You can visit our website to find a variety of DBT diary cards that you can download and print. Various informational handouts and videos, how to find a DBT therapist where you live, and many other useful resources. Each day, DBT clients carefully observe and record their target behaviors and the events, emotions, and thoughts that trigger them on a form we call the diary card. Here's an example of a partially completed diary card. Here's the part to report use of DBT skills. When struggles with emotions are exceptionally difficult, it is crucial to thoroughly understand the causes to have a good chance at succeeding with our goal of improving emotion regulation. First, it is a fact that therapy will not help you if the therapist relies on global conversations with you about why you struggle with emotion. It is much more effective if the therapist understands the specifics of recent emotion dysregulation episodes. But relying on asking the client in therapy sessions why an emotion dysregulation episode occurred has many limitations if a diary card is not used. Without keeping notes, most people fail to remember sufficient details of the events, feelings, thoughts, and behaviors, because people generally have poor memory for details, and intense emotion further interferes with memory. Surprisingly, it is also common that without a diary card, clients sometimes fail to report episodes of suicidal thinking, self-injury, drug use, or other important behaviors. Or they are revealed at the end of a session when there is very little time to help. Even if a person was able to effectively report the specifics without a diary card, using the diary card communicates a clear overview of important targets much more quickly, leaving about an extra 20 minutes in each session to work on solving your problems and building your skills. Based on the diary card, the therapist then asks very detailed questions about the precise chain of events, thoughts, emotions, and behaviors that led to a recent emotion dysregulation episode. Perhaps an act of self-injury, drug use, or rage, and then attempts to identify relevant solutions and skills that can be used in the future. There's a lot of research showing that merely writing down the occurrence of targeted behaviors each day improves those behaviors even without getting any advice or therapy. For example, it reduces smoking and drug use. It increases healthy eating and exercise. The reason seems to be that people become more aware of their habits, including their causes and consequences. Mindfulness is the core skill. It's a skill of effective awareness that improves our opportunities to make skillful, conscious choices. The diary card also involves important reminders about specific skills to practice. Frequent practice between sessions is an essential part of learning new skills. Lastly, your therapist will normally keep all your diary cards to objectively track your progress, whether your target behaviors, urges, and emotional misery are truly changing. Unfortunately, many clients resist doing diary cards because they involve time and effort, and often discomfort when they become more aware of their struggles. So you have to ask yourself, do you want an easier, watered-down therapy, or do you want one that is less easy and more likely to solve your problems? Those are some of the motivational issues with diary cards. Your therapist will help you with the practical issues that get in the way, like forgetting to do them. Now let's review how to complete the diary card. Here's an example of a client diary card. First, you write in the days of the week in the far left column with the first day in the first square. Because the last session happened on Tuesday, June 26th, this client wrote Tuesday in the first square, and that date in the upper right. Now let's rate emotions and urges. The columns marked here in yellow, all rated on a 0 to 5 scale, the highest level they are experienced on each day. 5 is the maximum possible intensity, where you can feel it strongly in your body, but many people become confused on how to rate the other numbers. It's important to realize that there are guidelines, but no right or wrong ways to use the number scale. The most important thing is to make sure your therapist knows what your numbers mean to you, and that you use your method consistently. It's also useful to vary your ratings rather than rating a specific urge or emotion always as a 5. SU refers to suicide ideation, which this client rated as a 3 out of 5 because he had 2 hours of 3 intensity suicidal thoughts and feelings right before bed on Tuesday, even though he had no suicidal thoughts or feelings earlier in the day. The 3 reflects his moderate intensity passive suicide ideation thoughts without any intention to kill himself or any specific plans. SH refers to self-harm urges, which he felt more strongly. He had very strong intensity self-harm thoughts and urges with an intention to harm himself soon and with a specific method that he was planning. So he rated a 5 for Tuesday, even though his strong intensity self-harm urges were brief and he had no urges earlier in the day. Fortunately, he did not act on his thoughts and urges for self-harm or suicide, so he marked no under the letters SH in the action section on the far right. A yes would be recorded in that column if there is any intentional behavior that inflicts immediate physical injury or a suicidal behavior that could have resulted in injury or death. But we do not count behaviors that slowly accumulate risk, such as cigarette smoking. If needed, you can use the diary card version that has columns to report drug use urges and drug use actions. The emotions section generally has 5 columns, and some diary card versions have 2 emotion words in each column so that you can choose the emotions that are the most relevant for you. Since this client has problems with anxiety and panic, but not anger, he crossed out anger. Since he has more problems with fears of abandonment and depression, he crossed out shame and sadness. His fear rating was a 5 because he had a panic attack on Tuesday. He usually rates a 4 for anxiety attacks and 3 for moderate intensity fear or worry or intense stress. Even though his panic attack lasted less than 10 minutes and he felt calm the rest of the day, his 5 rating reflects the strongest intensity fear that day. He felt moderately intense fears that his girlfriend would abandon him and felt strong depression about it. Emotional misery refers to how much you suffer from your emotions, how much you are upset about being upset. After learning distress tolerance, successful coping often involves having an episode of strong emotion that you feel in your body that you effectively tolerate and accept, using the skills of mindfulness of emotions and mindfulness of thoughts. When that happens, your number for specific emotions would be higher than your number for emotion misery. This client rated his emotion misery as a 3, even though his fear was as strong as a 5, which indicates some success at tolerating his fear. You see in the drugs and medications section that this client had 3 standard drinks on Tuesday, 2 beers and 1 shot of hard liquor. The Y indicates he took his prescribed medications as prescribed, and he reported not taking any PRN or over-the-counter medications. PRN refers to taking medications as needed, such as when a person takes Xanax or Ativan when they feel the need to calm down. The client reported that he lied once on Tuesday. The 5 indicates, on the far right, that he used skills that day and that they were helpful. In the empty columns, you can report anything important that you feel you need to work on, like attending work or school, aggressive behaviors, or specific impulsive behaviors of other kinds. In this card, the client decided to report the number of binge eating episodes. 2 on Tuesday. The backside of the diary card has a big list of skills to help you respond effectively to challenging emotions, thoughts, and behaviors. For each skill you practiced, circle the days of the week you practiced the skill. For example, this client practiced effectiveness on Thursday and Friday, so he circled those 2 days in the effectiveness row. He also practiced self-validation on Monday and Wednesday, so he circled those 2 days for validation. He exercised for 12 minutes on Tuesday, so he wrote 12 in that square, and 0 on the days he did not exercise. If you just started DBT, many of these skills will probably not make much sense to you, which is okay. For now, just focus on practicing and reporting the skills that you recognize and don't worry about the rest. You'll gradually learn the skills over the next few months. There's plenty of time to learn and practice. It can often be really helpful for you to write down notes of the specific triggering events and the specific thoughts that popped into your mind when your distress or urges got triggered, and your therapist will use these notes in the chain analysis to understand what happened. You can write these details in the section labeled Chain Analysis Notes or What Happened, or you can write these down on another piece of paper so that you have more room to write down more. Another useful way to capture these details is to audio record yourself as you describe out loud the specific things that you just noticed that triggered you and the thoughts that got triggered. Then you can play back the audio recording for your therapist. Here's where you can find copies of several diary card versions on my website. Please email me if you have any comments or suggestions for this video.